How long do NSAID-induced ulcers typically take to heal? Have you ever wondered how long it takes for NSAID-induced ulcers to heal? These ulcers are a type of peptic ulcer caused by nonsteroidal anti-inflammatory drugs. Generally, they take about 4 to 8 weeks to heal with the right medical treatment and by stopping or reducing NSAID use. However, healing time can vary based on several factors, including the size and location of the ulcer, the overall health of the patient, and how well they follow their treatment plan. NSAIDs can cause ulcers by damaging the protective lining of the stomach or duodenum. This leads to mucosal injury and can slow down the healing process. The standard treatment for these ulcers involves stopping NSAID use if possible. Doctors often prescribe proton pump inhibitors or H2 receptor antagonists. These medications help reduce stomach acid and promote healing while addressing any complications that may arise. Clinical guidelines suggest that with effective acid suppression therapy, most NSAID-induced ulcers start to heal within 2 to 4 weeks. Complete healing is often achieved by 6 to 8 weeks. However, larger or more complicated ulcers may take longer to heal. If NSAID use continues without protective therapy, healing can be delayed, and the ulcers may worsen. Key points to remember about healing NSAID-induced ulcers include the importance of acid suppression therapy, which is crucial for speeding up mucosal repair. Healing is typically monitored through symptom resolution and, in some cases, endoscopic evaluation. Patients are also advised to avoid NSAIDs or use them with protective agents to prevent recurrence. Healing times can vary, but for most ulcers, including NSAID-induced ones, it typically ranges from about 4 weeks to 2 months, depending on the severity and adherence to treatment. Some superficial ulcers may heal faster, but NSAID-induced ulcers usually need several weeks of treatment to ensure full restoration of the mucosal lining and relief from symptoms. If ulcers persist or do not heal, further investigation may be necessary to rule out other causes or complications. Always consult a healthcare professional for personalized medical advice and to follow prescribed treatment plans. This approach helps optimize healing and prevents serious complications like bleeding or perforation.